Hello everyone, I'm Preeti. I'm starting a new YouTube channel called Dialogue with Doctors to disseminate information on health issues. Friends, when we fall sick, our suffering is aggravated by our ignorance. So I want to provide authentic and reliable information about health issues in an accessible manner without using any kind of jargon. In each episode, I'll be inviting two medical doctors and engage in an extended dialogue with them to cover threadbare all the aspects of a major disease or disorder. For the inaugural episode of my channel, I have decided to focus on coronary artery disease. Friends, we are living through an epidemic. No, I don't mean the COVID-19 epidemic. I'm talking about the epidemic of cardiovascular diseases. That is, diseases of the heart and vessels. Among cardiovascular diseases, coronary artery disease occupies a very significant place as it affects millions of people all around the world annually. What exactly is coronary artery disease? Coronary arteries are blood vessels which supply oxygenated blood and nutrients to the heart, which in turn supplies this oxygenated blood to the rest of the body. As a result of the disease process, the coronary arteries become damaged. There is a buildup of plaque in them and they become narrow, thus restricting the supply of blood to the heart. The reduced flow of blood to the heart results in a variety of symptoms, such as shortness of breath, pain in the chest, pain in the shoulder and arms. When one or more of these arteries gets completely blocked, it can lead to a heart attack or even heart failure. How is coronary artery diagnosed? What are the signs and symptoms to watch out for? What are the treatment options? What is the recovery process like? And above all, what can we do to prevent the disease? In order to answer all these questions, I have with me two distinguished doctors for a panel discussion today. The first doctor is Dr. Vinod Sharma. Dr. Sharma is an interventional cardiologist and head of the Department of Cardiology Services at National Heart Institute, New Delhi. Dr. Sharma has given a new lease of life to thousands of patients of CAD. The second doctor on the panel today is Professor Abid Geelani. Professor Geelani is a cardiothoracic surgeon and head of the Department of Cardio-thoracic Surgery at B Pant Hospital, New Delhi. Professor Geelani too has treated countless patients of coronary artery disease by performing bypass surgery on them. Both of these doctors are leading lights in the field of coronary artery disease. I welcome you both, sir. Now, without further ado, let us plunge into the discussion on coronary artery disease, which I will refer to as CAD. Let me pick their brains and let's get to know more about CAD. Please stay tuned till the end of the episode to know all about CAD. Dr. Sharma, yes. In our day-to-day life, we hear dreaded words like angina and heart attack used almost on a daily basis. But we don't really know the difference between these words. What exactly do you mean by angina and heart attack? Yeah. Can you please explain?
Yeah. Preeti, as you said in your introductory remark, that coronary arteries are the tubes which supplies oxygenated blood to the heart muscle. And when this artery gets narrowed, then they produce a variety of symptoms. So a kind of chest discomfort which this narrowing produces, in technical term, that is called as angina. Now, the word heart attack is a layman term. As you mentioned that these arteries can get narrowed either gradually, and therefore they give a gradual symptom. What we call as a stable angina, when patient walks or does some activity, then he gets some discomfort. That discomfort is angina. But sometimes these arteries get suddenly blocked with the clot. And when there is a sudden cessation of blood supply to the heart muscle, so area of heart muscle get damaged. That is what is actually heart attack. or in technical term that is called as acute myocardial infarction. So angina is a word used to describe that symptom, and heart attack is a damage to the heart muscle due to sudden instantaneous occlusion of the arteries of the heart.
So if I understand it correctly, sir, can a patient have angina for several years without having a heart attack?
Yes, let's see the natural history of coronary artery disease. Coronary artery starts narrowing, say like at some point of time, and as the artery gets narrowed, the supply becomes less, especially on activity. So a person may initially remain asymptomatic, no symptom. As the narrowing increases, then he starts getting symptom on exertion, a particular level of exertion, a particular threshold of exertion that gives him symptom. That is called as a stable angina. And then these patients, some of these stable angina patients over a period of time, as their narrowing increases or there is a superadded spasm over the artery or clot formation over artery, they start getting pain at rest, discomfort at rest. Then this stable angina turns into unstable angina. And some of these so-called unstable angina may have sudden occlusion of an artery and would lead to the heart attack. So this is a four different phases on the natural cycle of a atherosclerotic narrowing of coronary artery. Okay. Phase 1, when they are asymptomatic. Phase 2, when there is a gradual narrowing, but narrowing is not critical, they get angina or discomfort at certain exertion, then they start getting discomfort at rest, and then one of them may develop sudden instantaneous occlusion and heart attack.